Welcome, everyone, to July's NAMI at Noon session. I'm Amy Brundle. I'm the Marketing and Communications Manager at NAMI North Carolina, and we are pleased to have everyone here for today's webinar. First of all, as always, we'd like to thank the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services for their support of today's webinar. And a couple of housekeeping items. If you have any questions for today's speaker, please put them in the Q&A section down below, and we will answer them towards the end as time allows. We will be sending out any materials that the speaker provides later on in the week or early next week, along with a feedback survey. And now we'd like to welcome today's speaker, Dr. Amber Khan. Dr. Khan is a national certified counselor, a licensed clinical mental health counselor, and holds a North Carolina school counseling license. She earned a bachelor's degree in psychology from UNC Greensboro. Dr. Khan then earned a master's degree in school counseling and a PhD in rehabilitation counseling and rehabilitation counselor education from North Carolina A&T State University. Since December 2020, she has served as the program director at the National Board for Certified Counselors Foundation. She's also an adjunct faculty member at the Department of Counseling at North Carolina A&T. Dr. Khan has a combined 11 years of experience in higher education and in the counseling profession. And in addition to a strong dedication to the counseling profession, she's got years of experience in advocacy and community service work, specifically serving immigrant and refugee communities. And for the past 11 years, she's served on the executive boards of 5 local nonprofit organizations. Dr. Khan herself is a first-generation immigrant, and in her many roles, she looks forward to continuing to bridge the gap in access to mental health services. Welcome, Dr. Amber Khan.
Thank you so much, Amy. I appreciate the introduction and welcome everyone to today's webinar. This is a very difficult topic to talk about at times, but it's also very necessary. So I appreciate the opportunity that NAMI has provided to have this conversation today and to really talk about all the areas that impact providing quality access and services to racially and ethnically marginalized populations. So I will share a little bit more about, I know Amy did a great job. Thank you for that introduction again, just going over my experience and just, what brought me to this field. I want to just spend a minute there and just share some of the things that I'm doing through my current job as a program director at NBCC Foundation. So this position is in a nonprofit setting, and it's really allowed me to spend time and serve the profession in a really unique and special way. And I definitely encourage you on the call to find out more about the programs that we offer. And so that the website is linked there. I've listed it there, and I will also share the slides afterwards with Amy, and we'll get these over to you. So you have all the links and the resources and everything that I'm sharing today. So yes, working in a nonprofit setting, really just that combination of bringing in the counseling background has been just really great. And so I really encourage everyone on the call to find out more about the many resources that we offer. And the other piece of this, community service and just getting involved has been just it's been very intuitive to me. Just it's come naturally, and just getting involved and being able to apply some of the counseling pieces with the nonprofit work. And all the organizations that I've been involved with have really focused on providing equity for marginalized communities, for our young people, and just promoting understanding between people who might not otherwise connect. So that's another thing that I would also encourage you all to do as community members. Those who are service providers, definitely look for ways that you can apply your counseling and your other training, and really get involved in the community through whatever avenue. So it's been just a great journey for me over the past 11 years, really just being a part of boards and just getting involved. And so I will put on my counselor educator hat also throughout this next hour because you know, that also comes very intuitively to me, just to share some of the ways that we can continue to get involved and offer our services in a number of different ways. And maybe even some of you who might want to pursue a terminal degree in the field, or those of you who are already on the path and just finding different ways to continue to serve. That's also very important to me. And I hope that you're able to gain some inspiration on that too throughout the next hour. And so I want to also go back to, what brought me into the mental health and counseling space. I learned a lot about myself, and I think a lot of my colleagues would agree that as we go through this journey, we learn a lot about ourselves, and especially coming from a marginalized community myself, I will be sharing some of those different aspects and challenges of what it's like to be a service provider who is also part of this community. As a first generation immigrant, what has that been like for me? And so I'll talk about that in a little bit. And so, yes, this presentation is a little bit of my own experience, personal experience, and the research that's out there. And then I will share some resources with you, and then we'll end the discussion there. So I do want to start with a land acknowledgement. I know we're all virtual and we're in different parts of the state of North Carolina, or we are in different parts of the country, but I think we can all agree that all the land that we're on is native land. And so where I am in central North Carolina, I want to recognize where I am, and I want to pay respect and gratitude to the indigenous people of this land and acknowledge that we're on the traditional lands of the Kiowa and Saguaro people. And so I I also wanted to spend a moment to talk about what this month means. And so just looking at and being reminded of, how this month was established. So it is July, National Minority Mental Health Awareness Month, and we have a lot of gratitude to pay to BB Moore Campbell, who was the advocate and the person who really was such a driving force. And so I think it's definitely appropriate to take a moment and, to show gratitude. And just, I just drew inspiration from so much of what BB Moore Campbell did as an author, a journalist, a teacher, a mental health advocate, and a founding member of NAMI in Los Angeles, and just bringing awareness to mental health issues that are faced by racial and ethnic minority communities. And so the purpose, so Congress established this in her name in 2008, and it was really to improve the access to the mental health treatment and services, and to just enhance the awareness around that. And NAMI Los Angeles was founded by a group of African American women, and it was the first affiliate that was established to address the needs of communities of color. So I think that's another thing I want to mention, just because I don't know if we'll all get to do the depth of the work that BB Moore Campbell did, but certainly drawing inspiration from that, and then in our own service and communities. I was fortunate enough to serve on the NAMI board, the Guilford County chapter, for 3 years, and it was a wonderful experience just to really learn the lived experience. I think as a trained provider, that was a different view that I had, but getting involved with NAMI at the community level was just, it was just very, very eye-opening to see how people navigate mental health for themselves and for their families. So definitely encourage everyone also to look into getting involved at the local level if you can with NAMI. You will not be disappointed, or you won't regret it. It's going to be really fulfilling in so many ways. And then I also want to just touch on a quote that really stood out to me, and I think it really captures a lot of, unfortunately, things that really have not changed much, even though when you look at this month being established in 2008, And, I did my dissertation that really focused on marginalized populations, and that was 5 years ago. And just doing more research more recently, a lot of things, a lot of systems are still broken. So it means that we have a lot of work to do, and there are still a lot of societal issues and barriers. So I'll read this quote by BB Moore Campbell, and it says, "While everyone, all colors, everyone is affected by stigma. No one wants to say I'm not in control of my mind. No one wants to say the person I love is not in control of their mind. But people of color really don't want to say it because we already feel stigmatized by virtue of skin color or eye shape or accent. And we don't want any more reason for anyone to say you're not good enough." So again, just, you know, thinking about the moment in time in our history when this month was established by Congress and where we are today, and just still navigating a lot of the same challenges on a systemic level. It just shows that we've got some things that we need to do. So I wanted to show up to this space. I don't always like to talk about myself, but again, I think it's appropriate for today, and I want to show up genuinely to what today is about. And I am a person who has a marginalized racial, ethnic, cultural, religious identity. So I'm going to touch on that as much as I can. But just to start off, my identity in this space has there's a lot of challenges. There's a lot of layers. I was brought as an immigrant to this country, and so that was in my childhood and into my teen years, but it certainly was a space that I had to navigate with difficulty. And English was also a second language for me. So just learning the language, adapting to the culture, those are all pieces of my life that have shaped me to be who I am, but also can't help but, have that be part of my work and what I do as a mental health provider. And so I've traveled quite a bit more recently in the past decade. I've traveled a lot overseas. So just getting back in touch with my culture and being able to do that in a way that really also helps me be a better mental health provider. That's something that I've reflected on quite a bit. And just finding that balance that I think all of us go through as immigrants. We have a lot of stress in trying to balance our identities and just really trying to be in a culture that where we are, not part of the majority group. So there's certainly challenges there as well. And so I have been really fortunate over the past, especially over the past 5 years. I have had a private practice, and that has allowed me the opportunity to serve immigrants who are in North Carolina, and they are from Africa, South America, Eastern Europe, the Middle East, and Asia. And so it's been just a varying, just a lot of variability in the type of um, situations that they're dealing with. Some have been here for most of their life, others immigrated just a few years ago. And so, culture and just navigating mental health with all the stressors that has been a part of a lot of the work that I've done with these communities over the past 5 years, especially. And then I also completed a dissertation on the immigrant community in North Carolina. That was also 5 years ago. I started working on that 7 years ago. So it's been a minute, but it's been also this point of just a lot of passion and work that I've continued to stay involved with. So I want to go back, just look at the bigger picture of where we are in our nation. So there was a 2022 survey, and so the results of the survey, there are two points that I want to highlight. 90% of the people who responded to the survey stated that they believe that we have a current mental health crisis in our country. And a third of those who responded to the survey stated that they could not get access to the mental health services that they needed. So, and then there's another um, thing I want to highlight, and this is very recent. This is just last year. The White House had had put out a report last year, and this is a quote from that, which states that our nation is facing a mental health crisis among people of all ages, and the COVID-19 pandemic has only made these problems worse. So, so again, today we're talking about marginalized communities, but I think we need to really look at what's happening with everyone. And things are already so difficult in terms of access that this problem has just really become worse, especially because of recent history and the things that have happened. And the federal government recognizes that. And I think it's also important for us to just pause and recognize what the challenges are that have come up and how these problems have really compounded for communities who are already marginalized. So another thing I wanted to highlight is the American Psychological Association reported that mental health access is an issue of equity. I I believe that the access piece is huge in all this, and I do believe there are different levels of efforts and programming and funding that are trying to offset this, but it's still to this day, this is an issue that we all should recognize and hopefully work towards finding some solutions here. So, also important to, who are we talking about when we say racially and ethnically marginalized communities? What's a measure of that? I definitely wanted to go to the data and just touch on at least what I know, and please feel free to share other perspectives here. So I'll start with, what are the current demographics of race and ethnicity in the United States? And so we can get a measure of that if we look at what the US Census Bureau reported to us. This is from 2020. And the census takes place every 10 years. So you'll get to see some of the changes that have come up in terms of, and I think this is really an issue of equity as well. So the Census Bureau goes off of the guidelines that are set forth by the US Office of Management and Budget. And so they've updated their standards and they've added another category. And again, this happened just more recently. This is after, of course, the 2020 census already took place. So before you had two options, you could pick ethnicity and then you would have to pick race. And so this was, again, an issue of, equity. There were people who took this survey or didn't want to. Some people didn't want to fill out applications, and we've also come across this issue in some of the work that I've done because we're also following the guidance provided by the federal government, and it's been brought to our attention where people did not feel like they were represented in the options. So that's been updated and addressed, and so now I will share what we believe. This is a sample. I think it was one of the articles. It might have been NPR. I'll share all the references of what I'm sharing with you today. So this is just a sample that they provided in terms of what the 2030 census would look like, and it's giving people more options. They don't have to be, they don't have to feel that they have to select one or the other and a category that is not representative of who they truly are, but they can pick other more options. And that again goes back to the issue of equity and representation and making sure that people feel like their voice is in whatever they're being asked to fill out. And so yeah, this is what we can look for in the future. And also I want to touch on how there had to be sort of this ask, just kind of a little bit more with I noticed this with some of the immigrant community, even in North Carolina, where people may not have wanted to or felt comfortable just with systems, and because of just all the systemic racism and discrimination that exists and the fear that exists, people who are immigrants may not always feel comfortable filling out forms, or they may not fill it out just because they don't feel that it represents who they are. And so there's encouragement on to that end, just to help people understand that when you fill out this data, it helps the government determine how to allocate resources. Because if we don't know how many people are in a particular state or city, then how will we know how to allocate the resources? So that's also something that I've not been a part of that advocacy, but it's just something that I've observed that perhaps needs a little bit more communication around in terms of just how we get people involved in all of that. So just the population estimates, so we can see again the big picture. There are over 334 million people in the US, and you can see the ethnicity and race of the different groups. So those of those who responded to the census, 19.5% were Hispanic or Latino, and then white, 75.3%, but white non-Hispanic, 58.4%, Black or African American, 13.7%, American Indian and Alaska Native, 1.3%, Asian, 6.4%, Native Hawaiian and other Pacific Islander, 0.3%, and then two or more races, 3.1%. So again, I wanted to share this data that obviously is changing as we are in this webinar today. Population is growing by the second. This is, the census again is a good source for that, and I wanted to share the data that we have at the moment so we can get a perspective of what's happening in our country. And but also the projections are showing that by 2044, that more than half of all Americans will belong to what is considered now a minority group, or any group other than non-Hispanic white. So those are the projections that have also been provided by the census. All right, so I've talked about the significance of this month. I've talked about the who the populations are based on numbers, and so just want to take a deeper dive into the barriers that exist for ethnic and racially marginalized groups. And so I think we can all agree that there's a history of racism that still exists in all the systems in our nation, and the cost of the economic, so there's structural and systemic barriers. Racism is a huge contributor to that, just the history of our country. And so then there's the cost piece too. And I know that even people who are not, living below the poverty line, there's still a huge barrier with, access to mental health. So you can imagine that it gets even more challenging for people who are living in tougher economic conditions. That creates additional barriers, and a lot of times it is communities of color or communities who belong to the marginalized population. So that is something that we all need to pay attention to at all different levels, and worth some work and updating on for sure. And so there's also in and the financial instability that ties into the economic barriers. But again, you might have insurance, but you might still need to live your day-to-day life. So being at a counseling session might not be something that is a priority for you, because you still have to go to work. And so it might not be someone who is low income, but they still need to make sure that they're financially stable. So, and it doesn't help all the things that we're facing right now in terms of the economy and inflation, and just how things have been very challenging for a lot of families right now. So there's also the cultural and linguistic barriers faced by different communities, and there's just not enough training. We don't have enough people who are trained to provide services, and we know that the federal government recognizes it. And I'll touch on a program that we have at Foundation that really is designed just for that, that I want you to also look into, because it's really centered on making sure that we diversify the workforce, and we really have people who are out there and available to meet the cultural um, needs of the clients that they're that they're serving. And that's also part of making sure that, they can retain the services and keep going back for the services that they need. Language plays a huge role. I'll touch on that again. Also, in terms of the diagnosing piece and connecting with your provider, that's a huge part of it as well. And then legal and policy barriers, that's also another issue, excuse me. So I can touch on, two examples of that when we look at our criminal justice system. That's certainly a barrier, and just that whole cycle, and just with youth that are part of these communities who just end up being part of the criminal justice system more often than those who are white. So that's also something that we need to pay attention to. People who are undocumented, they have a fear of going and accessing services without fear of just the system and fear of deportation. That's another issue that can come up in terms of the legal and policy barriers. So those are just some of the barriers. There are more, and there are nuances to all of these, and we'll continue to talk about that in the next few slides here. So just some highlights from the data. The American Psychiatric Association was the source of some of this information that's here. So there is a higher burden of disability for ethnically and racially marginalized groups. And this means that the persistence of mental health can be more likely in some marginalized populations. So, for example, the rate of depression might be lower in Black and Hispanic populations, but when you compare that with white population, but the depression is more likely to be persistent in the marginalized population. So that's something to really look at. What is that about? And so we'll talk about that a little bit more here as well. Another example of this, how mental health shows up differently for marginalized populations, there are higher rates of PTSD and alcohol dependence among American Indian, Alaska Native populations in comparison to any other ethnic and racial group. Going back to the legal and policy barriers, so when we look at mental health in the criminal justice system, so just some more data there, roughly 50 to 75% of youth in the juvenile justice system, they meet the criteria for a mental health disorder. So I think that's a call for everyone. What does that tell us? There's not it's the next point on the slide there. Instead of being connected with behavioral health providers, they're referred to the juvenile justice system. And so how do we change that? And that, of course, we know is also happening in the schools, where you have youth who are being disciplined by the officers at the school instead of being connected with counselors. So we need to certainly, try to get more counselors in there and really work with our young people on the behavioral concerns, and not just, look for ways to discipline them. So that's another part of all of this that's happening with our youth, and it's alarming. So going back to some of the points made earlier about cultural understanding, just the lack of training, and I want to just touch on the underdiagnosis and misdiagnosis of mental illness that happens. And so, what causes some of this to occur with pretty much all, I think pretty much all ethnic and racial minority groups, marginalized groups, this happens, where you are either just not diagnosed properly or you're misdiagnosed, and it's because the language piece is huge. Now, I know that if I go to a doctor or I go to a psychiatrist, or if I go to a counselor, any healthcare provider, if I can't even talk to them because there's a language barrier, how are they going to understand, um, you know, what's going on with me? I can't even talk to you there, and imagine if any of us are in, we're in Germany and we're trying to get healthcare. That's the experience when it comes to the language difference. And so I think the programming can take place, and I'll touch on, how do we solve some of these problems or try to, reduce some of the issues around this. I'll talk about that in a little bit, but this continues to be an issue. And then there's such a stigma associated with mental illness in a lot of communities, who it's just something you don't talk about. I know in my community, um, as an immigrant, it's not, it has never been an easy conversation. It's never been an easy conversation with the clients I've worked with. I've had clients who, some of them live in joint family systems, and they would not feel comfortable because families are big in our culture. So living together, even if you can afford it, you're going to live with your family, your parents, your siblings. That's just how it is. That's culture. We live in community, and not feeling comfortable to, go in and get the mental health services or go in for, telehealth was really big over the past few years. So that's been something that I've had to really navigate with my clients who are trying to access the care that they really need, but not feeling like they can do that because there's so much stigma and negative views on mental health in their family, and the culture, and they don't want anyone to, judge them because, oh no, so and so went to see, a counselor. I've also had many cases where people chose me to be their counselor, and they called me and said, I want to work with you because you are part of my culture, you're part of my religious affiliation, you look like me, I think you understand me, I want you to be my counselor. And that's another reason why I have continue to keep my practice going, because I see that there's still a gap. It's not as bad. I'm so glad to see the shift in North Carolina. When I started doing this, being in this field over a decade ago, it was really, I didn't have a lot of people if that was not my area of specialty and they really needed the cultural aspect of it. I couldn't refer clients out as easily if that was just a more, specific area of need that they had. And I'm happy to say that that has changed over the last decade. So I see this growth in different communities coming into this field, and I'm happy to see that across the board. But that's a piece of it. But then with the community piece, there's also this fear because some of these communities are smaller. So the stigma is, I don't want to come to you because, and it's also not understanding. That's part of the reason to have these type of events, is to really inform people that what you share with your counselor, legally and ethically in every way possible, we are just required by law to protect your confidentiality. So, it's just continuing to encourage people that if you go to a counselor, they're not going to, even if they're part of that community, legally, they are not allowed to share anything about what you've disclosed. So that's still a big piece of the challenge that I've even come across, is just the fear around, I want to get the services, but I'm afraid that somebody's going to find out. And I've had to explain that to them, that I can't do that. That's against the law. And then there are also cultural presentations of symptoms. You'll also see different people who are part of many different marginalized communities. The symptoms show up somatically. So you'll have someone who, again, is just completely ignoring the psychological piece of it, and they're just probably saying, I have a stomach ache or I have a headache, but it's all physical and it's not being diagnosed properly. And then it's also not being something that they feel, there's shame, there's stigma and shame around coming into the session and saying, well, you know what, actually, it's how I feel. It's how I feel. And there's just still a lot of work that we need to do in making communities feel that it's okay to, talk about these things. So just again, touching on the cultural stigmas and negative perceptions. That's an ongoing piece to this day. Engaging in my community, doing the work that I've been doing, it exists to this day, and we know it. And so still a lot of work to be done around this. Just something else I want to highlight is intersectionality of identities. There is also a lot of religious diversity. We are fortunate to live in a country that has a constitution that allows us to really practice whatever religion. We have a lot of religious diversity in this country. And so because of that, that's something else that really shows up for people, because religion is also another reason why a lot of people might choose not to get mental health services, because they're going to their religious leader, or you know just whatever that looks like for them. That is a part of a lot of what you'll see among ethnically and racially marginalized communities. So it's important to take that into consideration as well, whether you're a part of these communities or you're a service provider. So this is research, peer research, put this data out. So I just wanted to share it. I am sure that there is some more follow-up data that's been, or I'm sorry, more comprehensive data around religion in our country, but I chose this just to, just to showcase the diversity of the races and ethnicities in just if we're looking at the first two, Buddhist and Catholic, in this sample here of the survey responses, and looking at their religious affiliation, and then also what race or ethnicity that they identify as. So again, going into spaces where we're not assuming anything about anyone, and that's part of the cultural humility piece that I'll touch on as well. So, I think I've touched on this already, so I'll move on. And there's a quick video that I want to show that talks about intersectionality. So hopefully the sound works. We tested it, so let me hit play here.
What is
Just want to check real quick. Is the sound okay?
Sounds good to me.
Thank you.
intersectionality? It's a long word you may not have heard before, but it's everywhere, and it affects our health. Each of us has a unique identity. Elements of our identity can be used to categorize us into groups. All of us are members of multiple groups. We may be younger or older, a certain gender, race, or culture. For some of us, certain aspects of our identity may change the way we're treated and have an impact on our health. As examples, some people may experience gender discrimination in a work environment, and research shows that some people in racial and ethnic minority groups in the US have higher rates of heart disease than people who are white. For some of us, being a member of more than one group that experiences some disadvantage can compound or even multiply the degree of inequality we experience. How people are treated based on their skin color, gender, having a disability, sexual orientation, and other factors interact to affect people's health and other aspects of their lives. Intersectionality is when aspects of our identity overlap. This overlap may contribute to unequal health outcomes in ways that cannot be attributed to one dimension alone. For example, pregnancy-related deaths for college-educated Black women are 5 times higher than pregnancy-related deaths for college-educated white women. Black and Latina transgender women are victims of homicide at far higher rates than white, Black, or Latina cisgender women. And research has shown that as a group, gay, lesbian, or bisexual people of color have a higher risk of cardiovascular disease than white heterosexual people. The intersectionality framework can be used to provide an equity lens for public health professionals. Public health research and practice are better when we are aware of how different forms of oppression are interrelated and contribute to varying levels of advantages or disadvantages. It is important for us to use a comprehensive public health approach that addresses social inequities so we can improve health for all people. Learn more, take action, make a difference. Visit
So this was from the CDC, which has been a great resource for a lot of information, but the CDC also, put this statement out that racism is a serious threat to the public's health. And it's also, and I'll read this as well, that racism, and so what is racism? It is a system. It's consisting of structures, policies, practices, and norms that assigns value and determines opportunity based on the way people look or the color of their skin. This results in conditions that unfairly advantage some and disadvantage others throughout society. And so this is, unfortunately, you know, I touched on just the research that I did starting 7 years ago when I started working on my dissertation and looking at the impact in terms of mental health, and a lot of, you know, what we just looked at, that focus on public health in general. So this is a much broader issue than just mental health, which is one aspect of public health. So racism has a lot of impact on not just the mental health piece. Unfortunately, it's present in all areas of society to this day. And in those 7 years from when I was working on my dissertation, a lot of these things some of them have become more of a crisis than we're in. And also, you know, the killing of George Floyd really was a moment in our history that really required us to re-examine all the systemic racism in this country and the level of disparities that exist in this country. And we know that racism, a lot of data around this, we know it has an impact on where we live, where we work, learn, worship, and these are considered the social determinants of health. And being limited and marginalized in our access really also impacts the health inequities and creates poorer health outcomes for us. And so discrimination can show up in a lot of different ways in the healthcare setting. It could be interpersonal. So that means that you go in to see your service provider and there's unfair treatment. And then there's the structural piece, just not getting the access that you need to high quality healthcare. And so all that leads to people who are, you know, trying to utilize the system that they have. They just don't have as much trust of that system, and that can lead to worse health outcomes. And so this is another video that I want to share from the CDC that touches on this as well.
Most Americans want to live in a world that is fair and just. Unfortunately, in our society, many policies and practices give unfair advantages to some people over others based on their race. Race is a way our society groups together people with certain physical characteristics, like the color of their skin. Race is not about people's biology or genes.
We've all heard of racism, but we may not realize that racism is more than people treating other people unfairly because of their race, language, or culture. Racism includes the systems, policies, and practices that unequally hurt or disadvantage people who are not seen as white. Some people might think these things are in our past, but even today, there are still policies in place that harm people who are not regarded as white. And some policies have had lasting harmful effects on people depending on their race and ethnicity. For example, unfair housing policies have led to conditions today where people of color are more likely than people who are white to live in communities without access to healthy foods, public transportation, healthy homes, quality education, safe places for recreation and physical activity, and good medical care. Where we live, work, learn, and play impacts our health and well-being.
While a person's race does not increase their risk for poor health outcomes, race is a marker or a sign of other factors in our society that increase the risk for negative health outcomes. For example, research shows that people in some racial and ethnic minority groups in the U.S. have higher rates of diabetes, hypertension, obesity, asthma, and heart disease than white people, which is due in a large part to the systems, policies, and practices in our country that make it more difficult for many people of color to be as healthy as possible. We see racial and ethnic differences in health due to differences in how people are treated in society.
So what can we do to eliminate racial and ethnic differences in health?
Public health professionals and communities must continue to conduct and share research about how racism impacts health, develop effective interventions that counter racism, and develop and support policies across sectors like transportation, education, and housing that eliminate racism and its effects on health.
To build a better nation for everyone, we must commit to understanding and changing unfair and racist policies and practices that prevent us from achieving our best health as individuals, communities, and a nation.
I'll move past the barriers because of time. There's not a lot of time, so just quickly touching on some of the pieces that I've shared already. Discrimination, the pay and wealth gaps, all of these contribute. Cultural stigmas we've talked about, and cultural competence and versus cultural humility. I'll touch on that in just a moment. This is another video. I will come back to this if we have a little bit more time. So moving ahead, what happens with the barriers? We have delayed or avoidance of treatment that can lead to the increased severity of whatever mental health condition that already exists. And then there's this higher rate of emergency care use. I think we see this with the general population, but it's also this this idea of the stigma. And I see this in a lot of communities where there's this idea of, with men, I do see this in my culture. I can speak to this, just, being not showing weakness and then waiting until things get really, really bad, whether if it's physical or even if it's mental health, things getting really bad before taking action. And so just having to end up using the emergency care that's available instead of really taking the steps to go in and seek the services that are needed throughout. Not having the equal access, so there's disparity in the quality of the treatment and the lower rate of follow-up. We've touched on that as well, and that can lead to other impact, just increased stress, anxiety, also trauma. That's a huge piece of it. All these things can compound if the barriers continue to get in the way. And so this, I will also you'll have access to this article, but there were just some findings that showed the persistence of the concept of double jeopardy. So people, who belong to racial and ethnically marginalized populations, they have, and they're living with mental illness, there's this, again, the concept of double jeopardy because they're being stigmatized for both of those areas. And then there's just greater challenges for those populations because of that reason. And how do we improve? So I want to talk about some of these solutions. How do we improve things? There's certainly room for that. And so we should aim at all levels. You can do it at the grassroots level, the community level, and here in North Carolina at the state level, federal level, lots of ways to dismantle the racism through advocacy, through leadership, through the programs that we're building, making sure that we take an anti-racist approach to all aspects of mental health care. It's just not enough to say that, you're not racist. It has to be an anti-racism approach. And that's really taking action and really looking at all the systems and how do we approach all the things that are happening in a different way. There could be community-based interventions, and I say this because a lot of the cultures that I've talked about today, there's community in every one of these cultures, and community is a big part. And we know how loneliness also plays a huge role in, it's if we have the community is a protective factor. So feeding into those systems, especially for marginalized communities, is huge. Just bringing people together. And cultural awareness, continuing to make sure the material that you offer is, there's bilingual services, for example, or translation is available to ensure access. And then education and awareness, what we're doing today, this is a big part of it, just, reducing the stigma and ensuring that people are aware of what mental health is and where we are and how can we improve these things. So today is part of the education and awareness. And so our professions, and I'll speak just for the counseling profession, we as counselors, we follow the ACA ethical guidelines, and these guidelines really, we improve access if we follow these guidelines. So our principles are one of them, which I'll focus on for the purpose of today, is justice, or treating individuals equitably and fostering fairness and equality. So, counselors who are in the session today, or even those who are part of getting services, mental health services, we have a role to make sure that we create these spaces, we cultivate these spaces, and we follow the guidelines that have really been laid out for us by our profession. Some other guidelines in the ACA Code of Ethics really speaks on multicultural diversity considerations and non-discrimination. We have, as a counselor, I have a duty to make sure that I do not condone or engage in discrimination against anyone. And so that's something that we need to continue to remind ourselves as providers, but also make sure that all of the healthcare providers, whether it's, psychologists, psychiatrists, social workers, all of them are really aware that everybody has a code of ethics, essentially. But again, today I focused on the one provided by the ACA. I also want to touch on the National Board for Certified Counselors. Where I work, we have a code of ethics too, and as a nationally certified counselor, I have a responsibility to follow these code of ethics, and they guide me to ensure that I don't engage in discrimination, that I don't I don't do anything that would cause harm to the client, or I'm not imposing my values. That's another thing that does happen quite a bit when we're working in a space with somebody who's ethnically or racially different from us. We might come into the space and want to impose our own values because that's just the system that we know, but it's very, very important not to do that, because that also puts this pressure on the person who's receiving the services by the service care provider. And that's one of the reasons why people don't go back, because they're like, oh, this person really did not understand me, or they tried to impose their own values, and that was just an uncomfortable space. Multicultural competence. So competence I'll touch on. I do want to definitely talk about that, because that's part of that's not enough. And we are seeing a shift in the profession from the competence piece to the cultural humility piece of, how we approach the work that we're doing across, really, I think all healthcare settings. It would make a difference. Improving access, we can do this by definitely continuing to educate ourselves. I'm a lifelong learner. Yes, I have a doctorate in counseling, but I continue to learn more and more and improve what I do. And it's important for all of us to really do that, and also continue to share resources with others. I touched on using the anti-racist approach. That's very, important in terms of looking at, so looking at, racism as an important determinant of health inequities, and really understanding the cycle. So, racism and discrimination starts as a psychological stressor, but then it triggers a physiological response, and that has an impact on behavior, and that has an impact on both mental and physical health. So you see the connection between what the impact is when people experience these type of uncomfortable circumstances. And learning about coping mechanisms, that's also something important for all communities, but because we have such a stigma in ethnically and racially marginalized communities, coping mechanisms can turn into a lot of, substance use and addictions. I've seen that a lot in a lot of these communities as well. Instead of, seeking the treatment, that people are really, trying to heal their pain by using substances. Instead of going to see a therapist and talking about things, they feel that there's again that stigma piece. So they'd rather just use the substances to, reduce the trauma or heal their pain. And talking openly, reducing the stigma. I'll go past this quickly. Instead of saying, just want to highlight, this was highlighted by the American Psychiatric Association on their website, just some things to say instead of, saying, for example, you've got to pull yourself together. So I think this happens a lot in a lot of different cultures, because you're not supposed to show weakness. Just get yourself together, or just get over it. And that is very very damaging because it's not getting the person the help that they really truly need. And there's some more on stereotypes and prejudices and discrimination and how that's not just it also has an impact on people individually, and it's in structures and it's systemic, but there's also an impact on an individual level that's very harmful. Again, implicit bias, there's a assessment you can take. I've linked that. It's through Harvard, and it just helps you think more about what implicit bias is and how that exists for all of us, but also for in this space in healthcare and all that we're doing in this space. Implicit bias again plays into reducing the quality of care that we're giving to people. And then microaggressions, that also exists. Microaggressions are the verbal, nonverbal, environmental slights, snubs, or insults, and they communicate a negative message to people because of their membership in a marginalized group. So, for example, I've heard this a million times as an immigrant in this country. Oh, you speak good English, and so, but that is a microaggression because it pretty much says that you're different. That's what it says, and so I think we all need to take a closer look at how we, could be saying these things and not even being aware of it. So, I will, just for the sake of time, I'm going to move to the cultural awareness and cultural humility piece. So there is this shift to really understanding the cultural context, not just from, cultural competence. That's how it was, that's the training I went through as a mental health care provider. I was, taught about cultural competence. And so the idea right now is to really look at changing our view on that and, really looking at cultural humility as a better way to approach how we work with the people that are clients or just anyone. And incorporating this into the work that we're doing is important. I'll link this article as well. It's a great point of reference. It's to re-examine this piece because do we ever reach cultural competence at any point? Do we know everything about everyone? And because culture is forever changing and it's evolving. So to come into a space and then that can also lend to, stereotyping because we feel that we know everything about everyone, and that's never really possible. So that's where the cultural humility piece really comes into play, and really a point of consideration for all of us to not assume when we come into a space that we really truly don't know the intersectionality and the layers that are behind everybody that, is coming in as a client, or how we're coming into spaces of healthcare. So just some key conclusions of today. There are significant gaps in the mental health services that we're providing for marginalized populations. The federal government has really good programming, and please check out where I work, NBCC Foundation. We are federally funded, and we have a wonderful program that really is focused on making sure that we expand the access and that we're able to increase access and train the professionals in a way that increases the workforce in that way. So these type of conversations, they really help also to push the conversation forward and, get us to where we need to be. I've linked a ton of great resources. I know that there are more. There's also a lot of open access research that you can check out. So I know accessing journal articles, peer-reviewed articles, that's difficult once you leave school or if you're not part of an academic institution, but there's also a lot of really great resources, and your public libraries are also a great resource for that. So that's pretty much all I have. Please feel free to reach out and stay in touch. This is my contact information. And Amy, I'll send it back to you.
Yeah, thank you so much for this presentation. We had a couple of questions that were mostly based around making sure that these resources are readily available to everyone after the fact. So we definitely will be sending this information out. It will also have Amber's contact information on here so that if you have questions that you'd like to reach her about privately, you can do so. Unless we have any other questions pop up in the Q&A in the next couple of minutes, this will probably mark the end of our webinar. I'm going to put our, like always, I'm going to put our helpline information in the chat. So if you need help navigating some of these issues, especially as perhaps a peer of your own, you can reach out to us. I'll put that information in here for everyone. But otherwise, thank you so much for sharing this information. It's especially timely right now, I think, for a lot of reasons. And it's really good to just hear that good work is being done in this area. So thank you very much for sharing. Like I said, keep an eye out for an email probably by the middle of next week with any resources that we can provide, as well as the webinar recording and a short survey about today's session that we would encourage everybody to take. And then I will mention that our upcoming NAMI at Noon session for August is going to be held on August 21st, and it's going to feature Nicole Wallace, who's a Raleigh-based therapist, who's going to be speaking about healing from toxic and abusive relationships. So we encourage you guys to check that out once we start promoting that next week. Until then, of course, Dr. Amber Khan, again, thank you so much for joining us. It was a real pleasure to have you, and we look forward to seeing everybody back next month. Hold on with. Okay, so we have a question here. Dr. Khan, if you want to take a look at that in the Q&A section.
Yes, I'm looking at it. Yes, thank you.
Yeah, so the question is, this is coming from someone who identifies as a person of color, who thinks that racism cannot alone be a determinant of equity, and that it provides more ethno-racial understanding, provides more context, as well. Cultural competency has to be kept open for understanding from the patient to provide the context so that the provider can help navigate through some of those issues. What is your opinion on this?
Yeah. So I think this touches more on the cultural humility piece. And so I certainly agree. I think it's not just simply that's one piece of it, right? Racism is one piece of it. There's certainly that other piece, which is the interactions that take place on an individual level. And so we need to continue to improve those processes and really training our counselors in a way that allow us to, come into the spaces without the judgments and the stereotypes and having better understanding. So again, going away from that competency piece and making providers feel that they have all the answers. We really, really don't. And especially the way that if at least, because we're talking about our country, the US, in the US, the diversity and the intersectionality is changing day by day. So you have so much more diversity, even in terms of just looking at one group, one race, for example, and then knowing that there's so many different intersectionalities within that. So I believe we really need to continue to work on the individual interactions. So I would certainly have to agree. It can't just be this broader thing, but from a systemic level, from a broader level, that is certainly still part of the work that we need to do. The policies, and the advocacy that happens, that's still a part of the efforts that take place on that larger scale to dismantle the racism. And then on an individual level, really working with individuals to, so training is a big part of that, and education is a part of that. So I hope that answered the question. Yeah.
Yeah, and obviously, I mean, we could have this conversation for another 3 hours, but for the sake of time, we'll go ahead and let everybody go. Again, thank you so much, and look forward to getting this recording in the future.
Thank you very much. Goodbye, everybody.